All right. So why don't you tell us how you ended up at UT and what your career has been like since you started here?
Yeah, absolutely. So I went to medical school in Mississippi, and when I was looking at where I wanted to do residency, my sister was living in Houston at that time. I was a Spanish major, so I knew that Houston would provide me with a great outlet to be able to work with Spanish-speaking patients. And so those are probably the biggest reasons that I came here. Also, I think the city of Houston has wonderful diversity, especially for someone who came from a smaller town. And so really when I was looking around, Houston was my number one choice, and it's worked out great. I've actually been able to spend time with my sister. I've been able to use a lot of Spanish with my patients here at LBJ, and I've just really been happy with the diversity of Houston, both in terms of restaurants and art and culture and sports and things like that. I love the faculty here.
So tell me about the clinical opportunities for the residents here. What, where do you work with them? How do you see them? What is their role in patient care?
Sure. So I work with residents on all of the inpatient services that I'm on, which includes at Memorial Hermann on the inpatient service and at LBJ on the inpatient service. At LBJ, we also have an ambulatory rotation that's part of the residents' ambulatory block. So they do rotate through the GI clinic there. And we also have sort of our private clinics at Memorial Hermann that residents who are interested in GI have the ability to rotate in. And they can rotate with attendings with the hepatology part of our division, with general GI, and also with our interventional group. There's also, sorry, one other thing I forgot to mention is there's also numerous teaching opportunities where we work with residents. So the residents have various block lectures where we talk about, for GI, it'd be things like IBS or colon cancer screening. And we also have the ability to work with them on research projects. The residency program recently started a mentoring program with medical students for research, and I think residents can also be involved in that.
What do you like about the UT residents? How would you describe them?
So I've overall had a good working experience with the residents, especially those that are really, that are really sort of interested in learning everything. So one piece of advice I always give residents in any rotation is, even if it's not something that's at the top of your list, you should always show a lot of interest, because you never know, you may change your mind, and that person may be helpful in sort of helping you progress towards the next phase of your life, even if it's not in their specific specialty. So by and large, the residents have all been pretty eager and happy to learn and help out.
And then tell me about the fellowship. What do you guys look for in fellows, and what should applicants who are interested in GI fellowship look for in a residency or work on while they're residents?
Sure. So I think one of the things that I would recommend for incoming residents who are interested in the area is, if you have the options, to go to a residency program that has that fellowship. Because I would say, for instance, for me, for GI, it's extremely competitive. And you always have a little bit of a leg up if you have done well in your residency program, and that residency program also has a GI fellowship. Because that's one of the easiest ways for us to get to know residents up close and personal and see, really how they interact in, just casual situations and also in stressful situations. So that's one piece of advice I'll give residents. As far as what we look for, we want residents that, number one, mesh well with our fellows. You got to be able to get along with our fellows for us to know that you're a good fit in the fellowship program. And we do get a lot of input from them when we make these decisions. Number two, I would say a resident who has a great work ethic, who wants to be there, who is willing to, do whatever it takes. Obviously we do try to fit everything in within our regular workday, but there are days on occasion where you may have to stay a little bit later because you have a sicker patient, or maybe you have a really cool procedure that takes a long time. So we want residents that have a great work ethic, and people that are just really eager to learn, that are just sponges, that are just willing to help out and do whatever it takes to learn as much as they can.
What do you think are the things that pull people into gastroenterology? What do people like about it?
So I would say the number one thing people like about GI, in all honesty, is procedures. We do a lot of procedures. We do a lot of stuff with our hands. And when it comes to the internal medicine specialties, I would say GI, cardiology, and pulmonary are probably the three that most fit into that niche. I think number two, in general, people I would say they like the lifestyle. So if you were to compare the procedural side of GI with the procedural side of, say, surgery, very different lifestyle. And so I think a lot of people want to have that lifestyle and, make a good income and be able to do procedures. And finally, I would say continuity of care. So you do have a lot of patients with chronic GI conditions, for instance, inflammatory bowel disease or chronic GERD or things like that. And so you can still establish patients with them that you would have in a primary care clinic.
One of the things we talk about a lot is some of the crazy cases we see in Houston. Can you tell me about a case or something of interest to applicants?
Yeah, I would say so. One of the probably the most interesting things I've ever learned as a fellow and as an attending is foreign body removals. Recently, I pulled a spoon out of a patient's esophagus who said they inadvertently swallowed it. I'm not sure if I believe that. And so those are always cool cases. Also, and this is I would say this is a good learning experience. It's maybe not a happy story, but we do see a lot of people with advanced stage disease. And I think that it's because of the patient population here. And it is unfortunate, of course, but it also is a great learning experience for trainees. So I would say foreign body removals and advanced stage disease are probably the things that are really great learning experience for our trainees.
Yeah, how would you describe the population at LBJ? Because it's kind of interesting, right? Because some people would call it a community hospital, but I don't know that that's how we would describe it.
So LBJ it's a very different patient population. And while we're talking about this, I'll put in a plug for the fact that the residency program is going to expose you to a wide variety of patients. So you have LBJ, which is considered like our county hospital. These are generally patients that have a gold card for insurance. They may not have as many socioeconomic opportunities as far as medical care. The population itself, they are very grateful. They are very thankful. They're very appreciative of the care that you give them. They do often come with an advanced stage disease, and that's difficult. That's upsetting and frustrating, but it is a great learning opportunity. And the other thing I would say is one thing that's a challenge, and I think it's good for residents to learn, is how to communicate with this population, because a lot of these people may not have progressed very far in their education. And you've explained things to them multiple times. This is how you drink a bowel prep. This is how you take these medications. And I think that's good to learn because you never know, where you're going to practice in the future, if you're going to be in a rural area or something like that and have the same patient population.
All right, just a few more questions. Thank you for your time.
Yeah.
So you were a resident here. What are some of your favorite memories of residency, or maybe something you took away from residency that you would be willing to share with applicants?
So looking back now, so I graduated from residency in 2015, so it's been about 6 years. I'll be honest, some of my best memories are the memories of where you're, quote, in the trenches. So, I know duty hours and everything have changed, but I truly did enjoy having those 24-hour calls or whatever with my with my residents and, seeing everybody sort of pitched in and helped each other out. I think to that same end, being in the trenches would be things like multiple floods happened when I was a fellow. When I was a resident. I think Hurricane Harvey happened when I was a first year fellow. So, things like that where you really sort of bond together with the craziness of the experience. And those are the things I look back on, not the average old days. It's the great experiences I had with my fellows or residents, sorry.
Yeah, it's so true. It bonds us as a community. All right, and then outside of work, as a normal human outside of the hospital, what are the things that you like to do? I know none of us are real humans. Yeah. What do you like to do? What are your hobbies, your interests, cool things in Houston that you appreciate, especially during non-COVID times?
Sure. So during non-COVID, I love the travel. That's been a little bit of a challenge, obviously, but hopefully, when things get a little bit more normalized, I'll be able to travel some more. There's a lot of great restaurants here. It doesn't even matter what genre, whether it's Italian, Ethiopian, Korean, Japanese, Chinese. You've got a little bit of everything here. I enjoy the museum district. There's a lot of cool museums there. If you're interested in symphony, like I used to go to the symphony more, obviously have cut back on that since COVID, and certainly sporting events, Astros, Rockets, if you like soccer, the Dynamo, and just you got a little bit of everything here.
All right, what did I forget to ask you? What do the applicants need to know about this program to make the right choice? Anything else?
I guess here I'll talk about how to make yourself stand out. Well, did we talk about that? I would say if I had to give one of the piece of advice to an applicant, I would say figure out what makes you unique. You know, there's a lot of people applying for internal medicine or GI or whatever the fellowship subspecialty is that you're, you know, interested in. See what makes you unique and really, really highlight that in your interactions with faculty, and also highlight that during your interviews and in your personal statement. Because my most memorable interviews are with people that said, you know, oh, I'm really interested in this, or I had this experience, and that's what I remember.
Awesome. Thank you.